welcome to my conversation with Dr. George Pamborides. Thanks for joining me, Doctor.
Thank you for inviting me to join you. It's a pleasure.
Well, I know you're up late, so I won't keep you long, but I wanted the attendees of the webinar to hear about your experience working with me, because we started working together 6 months ago. It's gone by fast, hasn't it?
Yeah, we started in March. I was trying to find out how to start up a dental hygiene department in my clinic. And I was surfing on the web and I found you and a website. And then I emailed, and then I was lucky you answered back and started together the 45-day program, and everything was great. And I thank you for this.
Well, now you're enrolled in the online program, which has a lot of accountability. And can you address the experience that you had with our accountability and how easy it was for us? We're almost a half a world away from each other, but yet we were able to connect. And you know how I held you guys accountable at the office there?
It was great. The emails were answered almost as immediately as you could because of the 1-hour difference we have. We had our Skype calls every week. Any questions that I had, they were answered, even if they were included in the program or not. The information was fabulous, and it was a great experience, and it gave us a lot of power and motivation to start our hygiene department, and we are doing great.
So now, do you have like what I've given you so far? And you just started the 6 month, it's an empowerment, a hygiene department empowerment training, and it's mainly online modules with accountability weekly, and then these kind of calls each month with the hygienist, and then one-on-one with the doctor. So can you address how that helps you to get the system in place so your new hygienist knows what to do?
Well, this makes our department work in a very professional way. We make our recalls, we get our patients back, we don't lose our period patients. We explain to them the value of having a healthy mouth and healthy gums in relation to their health, general health. And okay, it's not easy, but the way you gave us the information, the phrases that you have instructed us to use with the patients, the language, so that we can get into their minds and try and make them believe what we say is so important for their health. And all this information that we have down on paper, writing down everything, the accountability we were talking, it's so much information. First, when you have a glance at it, you say, oh my God.
So one of the things that I wanted to talk about was that you didn't really know how to look at your numbers, so you had to talk to your tech person that works for you. Yeah. And when we looked, I was impressed because here you are in Cyprus, and you're right next to Greece, who's having this huge economic decline. And I remember when we looked at the numbers, I remember this from June, that you had, at that point in time, 237 new patients come to the office, and then we were able to get more patients who normally would come back. We have them coming back as well, which is why you really needed to get the systems in place with the scheduling, especially the hygiene schedule. And can you talk to these listeners about that? Because here you are in an economic decline, and most of these dentists and dental professionals listening are here in the United States. And our economy, I believe, is turning around, but look at what's going on with you.
Sure, we live in a country that we have a harsh time the last 2 or 3 years with the economic decline. But with good work and with a lot of motivation, you can get patients in the office. And don't forget that most of our patients don't have dental insurance. So they have to pay by themselves. So you can motivate the patients that they have to keep taking care of their teeth so they don't spend more money on implants or root canal treatments or fillings. So we try to make them realize that actually prevention will give them a healthier mouth and also less money spending on dentistry, and I mean on big money dentistry.
Yes.
And we are also in a country, in an area in general that has a lot of tobacco smokers. So we try to fight on this as well. And with the oral screening as well, the oral cancer screening as well by oral ID that you have instructed us to bring into our office, implement in the office, and it's doing great.
Wonderful to hear. And that is so profound. What you said was very important because United States, Americans, were so driven by insurance. And what you said is so valuable to the people listening to this because what you say, how you say it, the rapport. We've talked about the rapport that you have with your patients, and it's the culture in the country where you live that people almost think of you as their friend, and they rely on you to tell them the truth about what they really need. I think that's important for people that are in the United States and dependent on insurance to hear this message.
Yes, basically we make our patient pool through our friends, through mouth. It's basically mouth to mouth because we are a small community. I mean, my city, it's not a city, it's a town for you. It's 250 people. So the pool is not big, and we have to go around with friends and all this social life that we have to attract patients into the office. But because we know each other, they really depend on us talking to them, and they don't take it, granted that it's something between professional and friendship. So they rely on on the way we talk to them to convince them that this is good for their health and for their pockets as well. I said this before, but I'm saying it again.
So it's kind of like you're bridging the gap between a friendship and a professional level.
Yes.
And you bring them together. They want to keep coming back to see you. They have a deep relationship.
We have a deep relationship. And of course, this is a big step also for us to go into a dental hygiene, because a lot of people will say, I want my doctor to do it for me. I don't want the dental hygienist.
I don't want to keep you much longer because it's so late there. But if people want to talk to you, I think it would be interesting. There's probably people that want to meet you, and maybe they can email me, and then I can see if that's okay.
I am open to everybody. I can help anybody. It was great working with you, and it will be great working with you because we are in the 6-month program. And I think I was very lucky. I don't know how I got with you on the internet, but probably it was the lottery.
I think it was fate. You've been such a great client, and here you are up late at night. Well, you said that this isn't late for you, but I really appreciate your time talking with these other dental professionals, and I know that they can have the same experience as you because I really care. You matter so much to me as well as all the people that are listening now. I love what I do, so I'm happy to serve you in this way.
I thank you very much for inviting me to talk tonight with you and the other fellow dentists. And I have to say that I was very lucky, man, since March that we've met.
Thank you so much. I'll talk to you soon.
Okay, thank you. Good night.
Okay.